With kids back in school, we're getting a lot of questions from you about the COVID vaccine, like when children under 12 will be eligible, when it could get full FDA approval, and will the government approve booster shots for people who already have been vaccinated? Our political editor, Craig Patrick, is here with some answers for you. Hi, Craig. A lot of questions there.
Well, hi there. Yeah, of course, we have some 94,000 kids who have been diagnosed with COVID-19 across the nation just in the past week. And with that, you have a growing number of physicians and, of course, parents, too, who are exerting growing pressure on our federal government to accelerate, to speed up and approve vaccines for children under the age of 12. The FDA and CDC say they don't respond to that kind of pressure. They're focusing on this data, which includes, of course, the safety and the efficacy. But they're saying this is something that should happen soon. Best estimates from those outside of government agencies are saying maybe October or fall or winter. But the FDA commissioner says it's still all under review.
They are looking at safety and also what kind of dose should you use in people who are smaller, right? You might not use the same adult dose.
The data so far suggests when kids ages 5 to 11 are approved for the Pfizer vaccine, it will be a smaller dose, 10 micrograms instead of the 30 micrograms approved for those 12 and older. Pfizer plans to submit its safety data on 5 to 11-year-olds by the end of September and Moderna at some point this fall, meaning children ages 5 to 11 will likely be approved for the Pfizer vaccine first, then approved for Moderna. Now, the prior time frame of approval for adults and teens suggests 5 to 11-year-olds may be approved for the Pfizer shots at some point in October, but the FDA and CDC have no time frame on that and will not indulge in estimates.
What is a best estimate?
I'm sorry, I can't give estimates like that because it has so many variables.
After 5 to 11-year-olds are approved, scientists will then continue to examine safety and efficacy for those under the age of 5. But that will likely require months of additional review. At the same time, the FDA appears to be very close to granting full approval for the vaccines for those 12 and older.
I hope it's within the month of August.
When we move from the emergency use authorization we have now to full FDA approval, that will likely spur more companies to require their workers to get vaccinated, though many are already doing that. We still don't know if or when the government will approve booster shots for those who are fully vaccinated. Right now, scientists are still trying to figure out when or to what extent the protection they already have wears off.
The way this is done is to watch how immunity decreases over time in people who've been vaccinated, how fast, and when do we think it will go below the level that would protect people.
And there are ways to do that beyond tracking the breakthrough infections.
Drawing people's blood and looking at how their immunity drops over time, and that can help us a great deal as well.
Which is happening right now as we speak, and that's an important part of the process in determining boosters. But keep in mind, after there is full FDA approval, which we just showed you, maybe a matter of days, perhaps a couple of weeks away, based on what we're hearing at this point, at that point, then healthcare providers, doctors can then recommend those COVID vaccines for off-label use, which could, of course, flow into the possibility, if not the likelihood, of booster shots sometime thereafter. But there are other considerations. You look at the supply. You want to make sure you're not creating shortages for those who are unvaccinated, who are now stepping up with the rise of Delta variant cases. And they also have to determine, again, what the dosage of the booster shot, if there is one, Linda, should be. And they say that also could conceivably vary, if there even is one, from vaccine to vaccine.
So are other countries giving booster shots already, Craig?
Yes, some of them are. Israel's an example. France is an example. Germany's an example. In other parts of the world, specifically to people with compromised immune systems and to senior citizens as well, those at greatest risk. But again, their process is very different than our process, and our process certainly is moving along.
All right, Craig Patrick reporting for us. Thank you.